see a lot of changes in pediatrics that are already happening apace. The specialty itself will change as the child health population changes. There are some impacts on health like obesity and allergy, infection. These have always been things that we've dealt with in pediatrics, but they really are changing. Infection is a very important part of what brings children into interface with the medical system, as it were. And the impact of vaccines already being felt, rotavirus vaccine, chickenpox vaccine, meningococcus, this has changed the way we look after children already. And we can anticipate that, like every other area of medicine, resistant bugs will place an increasing burden on us as well as carers of children. There are children in the community who are surviving illnesses that in previous years they may not have survived. So there are many children with congenital illnesses, genetic diseases, who really have a very big impact on what is involved in looking after them, both in the community and as inpatients. And I see a real shift in what we're going to have to be focusing our efforts for in the next few years. Pediatrics is a specialty that, like any other specialty, is always evolving, reflecting the health of the population and new innovations and research. Some of the things that are coming out that are very, very interesting are the ambulatory care networks and the development of multidisciplinary teams excuse me, that are managing children with long-term diseases and many disabilities in the community. Other specialties that have really changed in the last few years and become more fully developed are palliative care. This is a huge area within pediatrics now. There's a lot of exciting work happening within palliative care and some very good, although still very few, areas where this is very highly developed. The critical care specialties like neonatology and intensive care are always changing. The establishment of networks within Thames Valley and really across the country have made this kind of work exciting and interesting. Patients are moving around more than they did before with the centralization of specialized services, and we have to keep up with that and find ways to make that journey not only bearable for children, but that's something that still offers them the best standard of care. So that kind of movement of patients between areas for specialized care is another area that's become very, very well developed in the last few years. I work in pediatric intensive care, and there are a lot of things that make me happy in my job. It's really easy to find ways to feel great about what I do because I have lots of opportunities to make very sick children very much better, sometimes very quickly. So there's no shortage of that kind of wonderful feeling of fulfillment and satisfaction of having made a child better. But one of the things I've learned, having been in pediatrics and as a trainer over many, many years, is it doesn't have to be something as dramatic as a life-threatening illness that gets better. There are many, many situations where just small changes that we as pediatricians make to children, by even something as small as changing the number of seizures that a child with seizures has in a week, or making some change by working with a multidisciplinary team to a very disabled child and how they go to school. Those sorts of things bring me as a pediatrician enormous satisfaction. And it doesn't take very much to make those changes and to really feel part of something bigger. There are many specialty doctors within pediatrics. By and large, they tend to be trainees who have started and embarked on a pediatric training career, but for one reason or another have chosen to work in a rather more focused way, either within a specialty or because they would prefer to work the hours that are tend to go along with being specialty doctors. Within the Thames Valley, we have many, many examples of excellent specialty doctors that have come through either from our own training program or elsewhere, but have veered into a specialty role. Pediatrics has really led the way in flexible or less than full-time training. There are a very high proportion of women who choose pediatrics as a career. So we see women earlier and earlier who are choosing to start their families at very early stages of training. And the School of Pediatrics here in our region, in the Thames Valley, has been absolutely wonderful at supporting those trainees right from the word go. And this is reflected through their training programs and, of course, in the career choices that they make later as consultants. If anybody thinks that they will be held back in any way by choosing to have a family and work in the training program and beyond in the specialty of pediatrics, then there really isn't any reason to be concerned about that. There will be no situation where you would be held back because of those choices. I think if you want to take pediatrics on as a career choice, you need to have a fair amount of energy. It is a specialty that is demanding physically and emotionally as well as intellectually, like many others. It's a specialty that really demands that you give everything of yourself to what you're doing to look after your patients. The models for practicing pediatrics are changing, so that what was a consultant-led service is now very much consultant-delivered service. So you need to be prepared to work very hard and to be very, very close to the patient. That in itself brings a tremendous amount of satisfaction, and not only as a clinician, but also as a trainer, because you're working with a very large group of people. But it's very, very important that you understand that you will be there delivering that care really right from the word go. When I think about a work-life balance, I think it's very important to understand that you can't really achieve any kind of balance unless you're really fulfilled in the work that you do. So it's really less about the hours that you do, the hours that you divide between your home life, your social life, and your working life. I think it's important that if you're not happy in any one of those, then you'll never achieve that balance. Pediatrics is a specialty that is largely populated by individuals who work less than full-time. So we're very used to the idea of managing individuals both as trainees and as consultants who have to work out ways to divide themselves in many different directions. To anybody who's thinking about a career in pediatrics and just beginning that application process, is to try to get as much information about the specialty as you can, and there are plenty of opportunities to do this. Certainly the Thames Valley has lots of career counselling available. There are career days run by the Royal College of Paediatrics, many events throughout the year that give you a really good sense of what the specialty actually has to offer and all the variety that comes with it, whether you're interested in an academic career or in a subspecialty. Pediatricians are amongst the nicest people around, very easy to talk to, very approachable. So if you are in the earliest stages of training and you need to get advice, I think there's no shortage of individuals who are very happy to meet with people and to give them plenty of opportunities to sort of taste what the specialty is like. I think what distinguishes pediatrics from other specialties, among other things, is the relationship that consultants and trainers have with the trainees that come through their program. There is a much, much closer and direct communication and relationship that happens between the trainee and the consultant than I think in other specialties. Consultants are very, very accessible. They are there as role models, they are there to lead, they're there to not only deliver care to the patient, but to provide a very high standard of training at all hours of the day and night. And I think that's really what sets us apart and what makes pediatrics a joy, not only as a trainer, but certainly as a specialty, and looking at trainees that are coming through. This is really reflected in the feedback that we get from pediatric trainees that have come through our program of the last decade. I've been very active in looking at people exiting the program and going on to very fulfilling careers within specialty and general pediatrics, and we get really wonderful feedback from the trainees that have come through. When we're looking for pediatricians to train, or prospective pediatricians, I think it's important to understand what kind of a specialty pediatrics is. It's different from any other specialty in that you're looking after a patient that is never really an isolated entity. Pediatricians have to be aware that a child is part of a family, part of a school group, part of a social network, and that has a major impact on their health and on disease and how we actually look after them. So I think having an understanding of that holistic approach right from the word go is very, very important for young doctors who are thinking about pediatrics as a specialty. It's absolutely critical that pediatricians in training work within a team right from the very earliest stages of training. We work with a tremendous number of members of a multidisciplinary team, other professionals within pediatrics and in adult medicine, and that kind of model where the human factors and the team approach to looking after children is absolutely essential, and being able to work in that kind of framework is very, very important. Young doctors who are thinking about pediatrics as a specialty really need to understand that it's a fairly challenging career. It's not for clock watchers. Pediatrics is for individuals who are prepared to work hard and who have a real enthusiasm and passion for looking after children and their families, because children are never isolated, they always form part of a later group, and understanding how that all works together is very, very important. I like to think that in pediatrics we have a very shallow authority gradient, in that you have a voice and are part of a greater team right from the very beginning of your training, and that interface and close relationship with your fellow trainees and with your consultants from a very early stage of training is not only the most rewarding part of training, but actually is fantastic for allowing you to develop the confidence and skills that you need in this quite challenging specialty.